Assalamu alaikum. I am Sonia Ajmal. I read in Government College University of Lahore. I am here to present a topic that is Marburg virus disease. We see all detail about the Marburg virus disease. First, we see that what is the Marburg virus disease. Marburg virus disease is a severe, often fatal illness caused by the Marburg virus. It is a highly contagious hemorrhagic fever virus. Marburg virus disease can cause serious complications such as internal bleeding and organ damage. The Marburg virus disease belongs to Filoviridae family of the virus like Ebola virus, so that Marburg virus disease is also called the cousin of the Ebola virus. It is classified as a biosafety level 4 pathogen requiring specialized laboratory facilities and strict safety protocol for handling. The fatality rate of the Marburg virus disease is extremely very high, up to 88% cases of this virus is cause death. The Marburg virus disease single-stranded RNA viruses and show negative sense single-stranded RNA viruses. Marburg virus disease is a highly virulent disease. So next we see that history and outbreak of Marburg virus disease. The Marburg virus was first discovered in 1967 in Marburg, Germany, following outbreak in laboratory workers who had handled infected monkey from Uganda. And this Marburg virus transmits species to species from vervet monkey to human. And since then, outbreak have occurred primarily in sub-Saharan African, affecting countries like Angola, the Democratic Republic of Congo, and Guinea. Recent outbreaks have also been reported in Equatorial Guinea and Tanzania. The virus has also been detected in bats, suggesting that they may be the natural reservoir of the virus, contributing to its spread and potential emergence in Europe. All these outbreaks have different mortality rate, that is 23 to 25%, 80 to 90%. Largest outbreak of Marburg virus in recorded in Angola in 2004. But this virus transmit from contaminated equipment, and the mortality rate is 80 to 90%. And just like Ebola virus, the Marburg virus also originate from bats and spread among humans. Next, we see the transmission symptom of the Marburg virus disease. The Marburg virus is transmitted through direct contact with infected bodily fluids such as blood, saliva, sweat, and vomiting, and also transmit from surfaces and material. And the Marburg virus disease also transmitted through sexual transmission. Symptoms are 2 to 21 days after exposure and include fever, severe headache, severe malaise. Many patients develop severe hemorrhagic symptoms within days. Disease progress rapidly to severe bleeding, organ failure, and death if not treated properly and effectively. According to CDC, the time between infection and onset of symptom can last anywhere from 2 to 21 days. After spending more days, these infection can cause serious complications such as internal bleeding and organ damage and organ failure, or can cause death. The Marburg virus affected systems such as cardiovascular system, lymphatic system. In the pathogenesis of Marburg virus disease, virus enter in the body through mucous membrane or broken skin. Virus enter in the host cell through phagocytosis and uncoat in the host cell and and viral RNA start replication in the host cell. When the replication of the viral RNA complete, they assemble in the Golgi apparatus and virus mature. When the virus mature, they release from the cell and leading to cell death and inflammation. When the virus release from the cell, the immune system attempt to fight the infection, but the virus can suppress the immune response, and virus replication and immune dysregulation lead to organ damage, including the liver, spleen, and kidneys. After that, when virus disseminate in the lymphatic system through lymphatic nodes, lymphatic node, widespread organ damage, and immune suppression lead to severe bleeding and potential organ failure. This is all about the pathogenesis of Marburg virus disease. Next, we see the diagnosis and treatment of the Marburg virus disease. In the diagnosis of Marburg virus disease, diagnosis is based on clinical symptoms, laboratory tests, and exposure history. For the diagnosis of Marburg virus disease, we also use PCR polymerase chain reaction for the detection of viral genetics, and we can also use ELISA enzyme-linked immunosorbent assay for the detection of viral antigens. If we discuss about the treatment of Marburg virus disease, there is currently no specific treatment for this virus, no antiviral therapy for this virus, no antiviral drugs for the Marburg virus disease, but supportive care, sportive measure therapies focus on sportive measures such as including hydration, blood transfusion, and managing complication is crucial. For the Marburg virus disease, experimental therapies, it means that ongoing research is exploring potential therapies including monoclonal antibodies and antiviral drugs. Next, we talk about the preventive measure of the Marburg virus disease. For the prevention of Marburg virus disease, we follow personal protective equipment such as wearing appropriate personal protective equipment including gloves, mask, and gowns is essential when handling potential infected material. And raising public awareness about the virus, its symptoms, and preventive measure is crucial for early detection and control. And vaccination, developing a safe and effective vaccine against Marburg virus is a priority for ongoing research and development. Next is biosecurity measures. Implementing strict biosecurity measures such as proper waste disposal and infection control protocol is essential to prevent outbreak. From the prevention of the Marburg virus disease, avoid close physical contact with Marburg patient. People who may have been in contact with someone infected with Marburg should monitor their health for 21 days. Next, we see that challenges in combating Marburg virus, such as limited resources, lack of awareness, social stigma, environmental factors. In the limited resources, the availability of resources, including healthcare infrastructure, diagnostic tools, and treatment options, can be limited in infected areas. In limited awareness and understanding of the virus can hinder early detection and prompt response to outbreak. Stigma, in the social stigma associated with the disease can discourage people from seeking medical care, potential worsening the spread. In the environmental factor, the presence of natural reserves such as bats and potential environment factors can make the virus difficult to control. ये दिस इज़ ऑल अबाउट दी मतलब ये मार्बर्ग वायरस क्यों नहीं हम कंट्रोल कर पा रहे हैं, ये सारी उसकी हमने रिसोर्सेज बात की थी कि उनके रिसोर्सेज बहुत कम है, अवेयरनेस की कमी है, सोशल स्टिग्मा बहुत ज़्यादा और इन्वायरमेंटल फैक्टर्स का तो सबसे ज़्यादा इफ़ेक्ट है कि जो लोग हैं ना जिससे हम मार्बर्ग वायरस की हम कंट्रोल नहीं कर पा रहे. नेक्स्ट वी टॉक अबाउट द करंट रिसर्च एंड डेवलपमेंट ऑफ द मार्बर्ग वायरस disease. We focus on the vaccine development, antiviral therapies, diagnostic tools, surveillance, and response. In the vaccine development, several promising vaccine candidates are in clinical trials aiming to provide effective protection against the virus. In antiviral therapies, ongoing research is exploring new antiviral therapies that can directly target and inhibit the virus replication. If we talk about the diagnostic tool, efforts are underway to develop rapid and accurate diagnostic tool to facilitate early detection and treatment. Investing in robust surveillance and system and response strategies is critical for detecting and controlling outbreak. Yeah, this is all about the current research and development. through for the Marburg virus disease. In this video, I tell you all detail about the Marburg virus disease and all details such as spread, symptoms, transmission, prevention, all about detail we discuss. So thanks for watching this video. I hope you must follow the prevention if we deal with the Marburg virus patient, infected people of from this virus. So take care of you and your family member from all the diseases and prevent all people. Thank you. Allah Hafiz.